Okay, before I even go to the outline, when you think about Civil War medicine, which I know you do a lot, right? This is something that you do in your spare time. But when you hear Civil War medicine or you think of Civil War medicine, what immediately leaps to your mind? Lauren?
This is going to sound weird, but that episode of Friends where Phoebe is talking about how
You just
when
made
she
my
was
day.
a Civil War
And she's
nurse,
like, oh, and there's like blood is shooting
I need more
everywhere.
gauze, yeah.
Okay, so that's an interesting thing to think about, but yes?
The lack of medicine.
What do you mean?
Like it was. There are certain things they didn't even think needed to be cured.
Okay. So maybe a lack of medical knowledge?
Yeah.
Or do you mean like a lack of training, or?
Like
Or
when
both?
she said, like they didn't really care about hygiene and stuff like that.
Okay,
They
so
didn't really think that these things were problems.
absolutely, yes.
They didn't have penicillin yet, so.
No antibiotics,
Antibiotics.
absolutely.
Amputations.
Amputations, yep, that's the big one. William?
Miasma theory.
Miasma theory, oh, yes, actually, that's part of it. Richard, you had your hand up too?
Well, I was going to say amputations, you beat me to it.
Raise your hand if when you think in your spare time about Civil War medicine, the first thing that comes to mind is amputation. Okay, yeah, that was my guess. All right, so today we have a couple of different things that we're gonna do. We have a couple different goals today. So we want to set the stage and talk about what the medical situation was like in the 19th century, on the verge, on the cusp of the Civil War, and talk about how the Civil War fits into that. In the process of doing that, we're going to bust some myths about Civil War medicine. One is that they didn't have any training and that they didn't really know what they were doing. We can't, unfortunately, bust the myth that they didn't have antibiotics because they didn't exist yet. Specifically, we're going to talk about amputation.
I've always heard that like after they amputated someone, they just like throw the next person on and like not even like clean this.
Yeah, that's pretty accurate.
Okay.
That's not a myth that we're going to bust. That was fairly accurate. So we're going to bust a few myths. I want to talk to you about a couple of different examples of people who survived Civil War medicine, who were, were helped by Civil War medicine. The treatments were successful. Let's put successful in air quotes, okay? So successful. The kinds of things that these people experienced, what it was like to be treated. And then I want to talk a little bit about how sick and disabled soldiers were sort of used by the Army. What use they were of to the Army. Okay, so on Tuesday we talked mostly about the Confederacy, talked mostly about the South. Today we're talking just about the Union. This is almost entirely for purely selfish reasons, and that's because my own personal research area is medicine and disability in the Union Army. So we're sticking to the Union Army today. But if you have any questions about how it correlates to the Confederates, please, stop me and ask. Civil War, we start in 1860. So we're looking at the history of medicine in the United States up to about the mid-century, right? And there's a couple things that we need to know in order to understand sort of what the medical situation is like during the war itself. One is that medicine, not just in the US, but medicine in the first half of the 19th century is not standardized. So when I say, oh, he was a doctor, that could mean many different things. There were lots of different ways of being a doctor in the 19th century. This is true even after the Civil War, but it's particularly true before the Civil War. So there are lots of different kinds of practitioners. So there were doctors who called themselves doctors, who went by doctor, who never went to medical school, just kind of declared themselves doctors. And often that was because they'd worked as apprentices, they had worked with or studied with another doctor who himself may or may not have gone to medical school. But then there were people who called themselves doctors who didn't practice what we would think of as like mainstream medicine. There are lots of different kinds of medicine. Medicine means a lot of things in the 19th century, so it can mean anything from sort of standard surgical practice, prescribing medications, evaluating patients, and almost akin to how we would think of it now. But it can also mean things like spirit healing. But there's lots of different things. One is homeopathy is incredibly popular in the first half of the 19th century. you can still go to Wegmans and buy homeopathic medicines in the Nature's Marketplace wing of Wegmans. Homeopathy is a theory of medicine where you take an active ingredient, usually something that's in an herb, and you dilute it until it's almost imperceptible, which through the mindset of homeopathy makes it more powerful. Where I'm going with this is that medicine is very broad. It's very multifaceted. There are lots of different kinds of doctors practicing in the early 19th century. And it is not clear to anyone that some of them are the right kind of doctor and some of them are the wrong kind of doctor. They're all just practicing alongside of each other, right? But there is a faction of doctors that are what we would call scientific doctors, or what we would call today doctors, right? Just doctors. But they practice a kind of scientific medicine. Mostly they've gone to medical schools. The thing that really set those doctors apart, the people that we would think of today as mainstream, practicing physicians, was anatomical training. They had either had training in dissection, which is standard in medical school today. It was not then. If you had anatomical training, whether through performing dissections yourself or through going to anatomy lectures and watching a dissection take place, that really set you apart as a scientific doctor. Though they were the best of the best. They were the elite. So we have this, one subset of doctors amidst all of these different kinds of practitioners who have scientific training, right? And they want to have the control of the medical practice. They want to be the only doctors, right? They want it to be like it is now, where when you say doctor, we all think the same thing, right? Someone who went to medical school. So 1861 comes around, and the medical field has a real crisis on its hands, and that is the Civil War, right? The Civil War presents an unprecedented health crisis for the United States. We have not, since the American Revolution, we have not had a health crisis like this. So almost none of the doctors living in the United States at the beginning of this war had any training with, combat trauma, right? They had never seen the kinds of wounds, the kind of illnesses that they would see during the Civil War. So in 1861, when the first couple of battles take place, the Union Army realizes really quick that they're going to have to organize some kind of medical corps or a medical department that is ready to mobilize to meet the health crisis that a battle creates. And now the problem is, we have all of these different kinds of practitioners, homeopathists and mesmerists and Thompsonianists and you name it, herbal doctors and all different kinds of doctors, right? How are we going to decide who gets to be in this medical corps? And this is a real problem, because if somebody's, been wounded with a mortar shell at first Bull Run, do you really want someone standing over them shooting energy into them, right? Or would you rather have someone who might have at least a tiny bit more of a clue how to handle that kind of trauma? So, the other problem is the Army Medical Department, which is what the medical bureau of the Army was called at the time, the Army Medical Department, was not up to the task. It did exist. There was a medical corps, this Army Medical Department, but it was very, very small. It was almost non-existent. The sitting Surgeon General was elderly. He was not going to be of any use, which is kind of a running theme, right? Winfield Scott, also elderly, overweight, not going to be able to do the job. So it becomes very clear that we have to figure this out. They get rid of the elderly Surgeon General pretty quickly. They put in place another guy whose name is Clement Finley. He does not stick around for very long either, because it's just clear that he's also not up to the task. And eventually we get in place a guy named William Hammond. So now we've replaced this older, kind of ineffective Surgeon General with William Henry Hammond. He immediately starts to make some changes. And one thing is, he's a regular doctor, right? He's and I mean the term regular, not like he's just a normal guy. I mean, literally, they use the term regular to indicate someone who was a scientific doctor, someone who had gone to medical school. So he's a regular doctor. He wants the Army Medical Department to be just regular doctors, right? And he has some ulterior motives here. One is that he thinks that they do the best job, which they do, right? But also because this is an opportunity for him. He wants scientific doctors to corner the market in medicine after this war is over. So he knows this is the biggest crisis facing medicine in the 19th century. If the regular doctors control this, we'll control the rest of the medical field, the medical practice after the war.